I decided to become a plastic surgeon when I was 13 years old. A plastic surgeon came to speak to our class one day, and I was mesmerized. He showed us these photos of what he had done to patients who had either suffered trauma or cancer, also some cosmetic surgery patients as well, and showing what he'd done before and then after was just amazing. I was completely blown away, and right then and there I decided that's exactly what I would like to do as well. Since that moment, I did everything I could to immerse myself in plastic surgery through medical school, through residency, any time I could spend with other plastic surgeons, research on plastic surgery, just anything I could do to gain that knowledge and to become a plastic surgeon. I did it. Through medical school and seven further years of training, what I came to realize was not only was the before and after impactful just for me personally, I began to understand how impactful it was with the patient. And that feedback, that giving a patient that confidence when we took them from the before to the after had much more meaning, and that's been very rewarding to understand that. Every patient I see, they're not a number, they're not a commodity, it's a relationship. The relationship with the patient is the most important, and their well-being is the most important. And whatever we can do to get them to where they want to be, I'm going to do that. When I see a patient, my goal is to provide them an honest assessment. They've made a big commitment to decide to come in to see someone and discuss or show something that they feel insecure about. I want them to feel comfortable with that decision to do that and feel comfortable sharing that with me. Part of discussing a treatment plan with a patient is making sure that they have appropriate expectations. And is this procedure, whether it's surgery or another minor aesthetic procedure, is it right for them? Getting to your final aesthetic goal sometimes means surgery, and sometimes it means other aesthetic procedures that are not surgery at all. I'm here to help them meet their aesthetic needs and goals. When a patient contacts us, my staff's focus is solely on them, and they're going to receive individualized care. They're going to feel comfortable, they're going to feel confident in the practice and the whole process from beginning to end. Seeing firsthand what plastic surgery can do for patients is much different than seeing someone when I'm 13 years old talk about plastic surgery. And so now that I can live the before and the after with the patient, I now realize the emotional aspect, the confidence aspect, the empowering your patient aspect really is fulfilling and really adds to why I love doing what I do.